Depression affects tens of millions of Americans every year. Maybe you or perhaps your loved one may suffer from it. If medication isn't working, maybe it's too expensive, you need to know about a free clinical trial that's happening right here in San Diego because you matter. Here now to tell us more about their ongoing trials of new treatments is Dr. Greg Applebaum, Research Director of UCSD's Interventional Psychiatry program. Dr. Applebaum, thank you so much for joining us here on the floor.
Thank you. My pleasure.
Let's talk a little bit about UCSD's Interventional Psychiatry program. What is this all about?
Yeah, so interventional psychiatry is a type of device-based and pharmacological treatments for mood disorders, in particular depression. And we have a clinic at UCSD that provides these types of treatments for our patients.
We mentioned free clinical trial, and I know for people that might be suffering from depression, their ears might perk up, thinking, it's expensive to go to a doctor, then you're on medication, and there are side effects to the medication. This is relatively non-invasive, right?
Yeah.
Tell me a little bit more about this and what people have an option to sign up for here.
Yeah, so in particular, we're offering 3 different trials that use transcranial magnetic stimulation, or TMS. And TMS is an approach that uses magnetic pulses delivered to the brain to either kind of tamp down parts of the brain that are overactive or boost up parts that are underactive. And it's a procedure that takes a few minutes for each of the sessions. You just kind of sit, relax, the magnetic field's delivered to the brain. And the idea is this kind of regularizes the brain, brings it back into a normal balance, and that has a curative effect on depression.
Wow, so people have an opportunity to sign up for the trial for this. How old do you have to be a part of the trial?
Adults, anyone 18 to 80. Most of the trials end somewhere around 80, 75 possibly.
And as far as the time commitment is concerned, obviously they would come back for several sessions of this?
Yeah, so we're really offering 2 different types of trials. So TMS comes in 2 flavors. One flavor where you come once a day for a session. They usually last about 5 or 10 minutes, and you do that for 4 to 6 weeks. Or what we're calling accelerated trials, which you pack that all into 1 week. So it's 10 sessions a day for 5 straight days, and you get the whole treatment done in a week. And we have trials that do both of these types of treatments.
Relatively pain-free. We're looking at some video here. It doesn't look like these people are suffering at all.
Yeah. It's very relaxing. The side effects are very minimal. They might get a little bit of tenderness under the coil, sometimes a headache that you could relieve with a little bit of over-the-counter pain medicine, but it's a non-invasive procedure, very minimal side effects.
I've heard of TMS before, and I'm glad to know that it is still being studied, including right here in San Diego, but do we have any feedback yet as far as, is this working for people?
Yeah, so kind of holistically, TMS works particularly for people who haven't responded to antidepressant medications. So in order to qualify for TMS, you have to be what's called treatment resistant, which means that you failed 2 antidepressant medications. For those people, TMS works a third to 50% of the time, which is pretty good considering that other medications haven't worked. And what we're really trying to do is increase that effectiveness. And so the trials are testing a couple different approaches to try to make it more effective.
Okay, so this is definitely ongoing. We need more people right here in San Diego to sign up. If people are saying, hey, I might be interested in this, where do they go to sign up or to get some more information on exactly what TMS is?
Yeah, so we have a website. We have an email, iptrials@health.ucsd.edu. Possibly you could
It's right there on the screen
put
for
it on
folks
the screen
too.
for
Yes.
your viewers. And speak to our coordinators. They will talk to you, explain what the trial is about, whether you qualify or not, and give you kind of information about the logistics to see if it's right for you.
All right, and once again, it's free for people, and I think that in itself is such a relief when they're in the midst of going through depression.
Yes.
All right, Dr. Greg Applebaum from UCSD, we appreciate your time, and keep us posted on the clinical trial and how this works out for folks.
Well, thank you
All right,
very
thank
much.
You. Anna.